So we just took the stitch out up top here, okay? The eyelets above and below are not what the suture line is. The suture line runs in between those eyelets. So if you look up here, here's this previous suture line. So that would be this running in between, and you can already not even see that. So let's just follow it all the way around. So these tiny little hairs will continue to fill in. Even if our patient Esteban were to cut his hair short, you still won't be able to see that suture line. What you have to realize is we're only at 10 days post-op and you can't find that suture line. The suture line continues to heal for about a year. Our patient Esteban learned to be a better patient because this is his old suture line right here, which is still a perfect suture line. But here, this is undetectable. I mean, this is literally as good as it gets. Now I have patients that will seek out the technique called the follicular extraction. They seek out the follicular extraction because they want a scarless surgery. Well, that's a misnomer. There's no such thing as a scarless surgery. What happens with the follicular extraction is you just have more scars because of the way they harvest the donor. Now, there's no reason to seek out a follicular extraction when you can get a result like this with your suture line. An undetectable suture line can be attained if the patient's a good patient, they follow their instructions the way our patient Esteban did. You were a perfect patient, okay? I give credit where credit's due. You don't get a result like that without having a perfect patient. So he did his part, he took great care of it, and he's going to get an excellent result. And that's a big part of what we always have to explain to each and every one of our patients is we'll do our part, but then it's up to you to do your part. So if you take care of it, you're going to have an excellent result like our patient Esteban.